Do you work in an MSK setting and see children and young adults? Do you know when the child's skeleton fully matures and how that might affect diagnosis? Consider the photo of the hockey player here. What age do you think he is in this photo? Let's see how good your knowledge of the maturation process is. Jot down the answers to the following 3 questions. Around what age does the human brain fully mature? At what age does the proximal hamstring insertion onto the pelvis fully ossify to consider a diagnosis of a high hamstring tendinopathy more probable than an avulsion injury? And bone stress injuries are more common in children, but at what age does the ossification centre of the pars region of the vertebrae fuse and make this injury much less likely? So now let's see how you did. The child will continue to make emotionally based decisions until often around the age of 25. The hamstring attachment to the ischium doesn't fully ossify until around the age of 23 to 24. And the pars region of the vertebrae ossifies around the age of 23, with only around 6% of bone stress injuries occurring in people after that age in the lumbar vertebrae. So he looked like a man, but here at age 19, much of his body remained that of a boy, and he was therefore at risk of many of the pathologies that relate to growth tissue. To be able to accurately diagnose patients before skeletal maturity, it helps to be able to calculate the percentage of their predicted adult height so that you can see how close to their adolescent growth spurt they are and how mature they are currently. But do you know how to do that? There's huge variation in biological age between children who share the same birth date. And in these images, the children are the same age, but as much as 6 years apart in terms of maturation. As clinicians, we need to know their maturation status to support our clinical diagnosis and rehabilitation. Kids are not mini adults, and so if you don't feel confident in assessing and diagnosing sporty kids, or are unsure when to send children back to sport and want to learn more, join us in Liverpool on September the 21st to 22nd at Rehab for Performance and learn how to get kids to do exercises, how to educate them to reduce the risk of recurrence, and how to prepare them for the chaos of the sports field with comprehensive return to play strategies. Visit angelajacksonphysio.com for more details